It hurt to walk. It hurt to do anything. I needed help going to the bathroom. I needed help showering. I needed help getting dressed, doing like the most basic things. When did I learn that you could braid? I feel like recently.
Really? Probably during surgery, right? You were always like, oh, can you braid my hair? And I was like, yeah.
Yeah, I never knew how to braid.
You don't know how to braid?
I can do basic braids, but I always used to get sad like going to dance class when I was young because like everyone else would have their moms braid their hair. And I just had a crazy hair and couldn't braid. I knew I had surgery and wouldn't be able to shower for a while and wanted my hair braided for a week. I found my doctor on social media. I feel like I was forced to be my own best advocate. It wasn't something I grew up learning how to do or feeling empowered to do. I was definitely of the mindset of, you know, what a doctor shares is gold, is the law. You follow it, you abide by it. You try to make their jobs easier. So I feel like I had no choice but to work through that and to really stand up for myself. Okay. And that. Undies, you can't see that. I am in San Francisco to have my 1-year sensation test following my preventative double mastectomy, which had nerve grafting and nerve preservation.
Breezy's first day of school. Ah, you excited? Yeah? Here they go, first day of school.
I first became aware of breast cancer when I was 5 years old. My mom was diagnosed. She actually was misdiagnosed 3 or 4 times. She was breastfeeding my younger brother, who was just born, and noticed that something was wrong, that he wasn't feeding from one side. And she went to the doctor several times and was turned away. Her sister had just recently had a breast cancer diagnosis, so she was aware of her family history. She herself was a nurse, so she was aware that something was wrong, but she believed her doctor that it was nothing. No imaging was ordered, even though she wanted it, until she came back really unable to even lift her arm or hold my brother. She was diagnosed with advanced disease, but unfortunately passed away. So I became very aware at 5. Not that I understood what it was, but I understood that that was something that caused me and my 2 brothers to grow up without a mom. My personal decision to have surgery finally really hit me when I realized that I would be okay if I got to the end of my life and someone said, you know, you never were going to get cancer, you didn't have to have this drastic surgery. I realized that I'd be okay hearing that, but I wouldn't be okay hearing the opposite. To be honest, when I first thought of having this surgery, I mentally accepted that I wouldn't have sensation, that, you know, that whole part of my body would be completely numb, and that's something that I just tried to make peace with. And then when I heard that it was an option to have sensation or try to have some sensation, I just thought that would be amazing and be a great option to at least try to, I guess, feel more comfortable in your body again.
Hi, how are you? Good, how are you? Good. All right, so I just want to take a quick check over on this side.
The nerves, especially on the outside of the breast, kind of run through the breast tissue and into the skin and nipple. So traditionally those nerves have just been cut through. And what can happen is not only can numbness occur, but those nerves can also get scarring around them, which can lead to painful sensation. So a lot of people have something called post-mastectomy pain syndrome, which is essentially chronic chest wall pain. So we really think about, as the first step, can you look for those nerves and try not to injure them? For most people, the nerves that go up to the nipple and to the central skin actually go straight through the breast tissue. So they run along the chest, they go through the breast tissue, and so obviously we can't keep those nerves because we need to take out all the breast to be safe from a mastectomy standpoint. So when we do sensation-preserving mastectomies, we look for those nerves, we avoid injuring them until we need to cut them, and then now we have a nice, clean, uninjured nerve end that we can use for reconstruction with a nerve graft. I was diagnosed with breast cancer myself at 37. And when that happened, I was really scared about going through mastectomies because I was really worried about what it would be like to have a whole part of my body be numb. I would talk to one of my friends who had had mastectomies a couple years before, and she would say she didn't even feel that her sports bra was on. And so for me at 37 with a new diagnosis, it just felt like too much to wrap my head around to think about being numb for the rest of my life. So ultimately I ended up deciding to have a lumpectomy to try to avoid that as one of the reasons. And so soon after my surgery, my husband Ziv and I were talking about, why couldn't we reconstruct nerves in the breast? Why couldn't we try to preserve them the way that we do in other parts of the body? He's actually a peripheral nerve surgeon. He specializes in treating nerves all over the body. And so between the two of us, we were able to come up with a technique.
For the longest time, we have been really focused on the sort of oncologic outcomes of breast cancer surgery. While we have made incredible advances in that, and those are wonderful and incredible, and I'm very grateful personally for those advances because of Anne's diagnosis. I think there needs to be a little bit of a shift toward the quality of life that these women will live with.
Sexuality, intimacy, sensuality, a lot of these topics don't get talked about much in the world of healthcare in general, and certainly not in breast cancer care. But even just bringing up that you don't want to feel numb, that it feels really strange to think you won't feel when you put clothes on, even to keep it in that realm, I think just bringing that up allows your surgeon to think about the fact that it matters and that perhaps they, as someone who cares about you and is invested in your health, wants to figure out how to offer you that.
I think it took me about a full month to look at myself in the mirror. I would avoid mirrors, like going to the bathroom, going to shower. I consciously decided not to look at myself. I remember looking at myself a month later when I got home from San Francisco and definitely feeling pretty emotional. My scars were still very raw. I still had surgical glue that hadn't come off yet. I still had some scabbing. I just definitely felt like my body was very medical. Now when I look at myself, I think I'm definitely more comfortable and just making more peace with myself. I wouldn't say body positivity, but I would say kind of body neutrality, just, being grateful for what I was able to do and that I'm able to do things in my body again and not think about my body is what I'm grateful for.
When you lose complete sensation to a part of the body, the mind tends to disconnect from that part of the body. You might be wearing a piece of clothing and not realize that certain areas are showing when you can't feel it and when you haven't felt it for a long time and have learned to basically completely ignore it. Going around in everyday life and being able to feel almost normal in the long run leads to this sort of psychological state of mind where you aren't constantly reminded of the fact that you've either had breast cancer or had to have a pretty significant procedure to try and prevent a breast cancer. And I think that hopefully, and certainly what I've seen, is that in many cases, a lot of women are saying that, there are many days where they don't realize they had anything done, and that's really the goal. So the neurosensory testing that we do is really a very sensitive and very accurate way of measuring your ability to perceive fine touch. The way the test works is we have a little metal prong that's not sharp and we press very gently on an area and we press harder and harder and harder until the patient indicates to us by pressing a button that they actually feel it. So we can measure how sensitive their skin is to that very fine touch, both before and after surgery, and it allows us to see how close we can get to where we started, which is always the goal.
When we look at all the patients that we analyze, 95% of the baseline values, meaning before any of these women have had any surgery, fall under 20 grams per millimeter squared of pressure. So the fact that you're back there is amazing.
I first learned about the option to have a sensation-preserving mastectomy when I was looking online for other people sharing their stories who've had mastectomies. And I saw someone in San Francisco who's now a good friend sharing her story in live time on social media. Being able to know your options, know what's available to you because of another person is everything. I wouldn't be here today without that. I wouldn't have known that I had a voice, that I had a right to choose a doctor that I liked, to choose a surgery that fit me, and not just done what I was told. I was told that the surgery that I've had, I was told that that wouldn't work for me, wouldn't work for my body, that I'd have to have 2 surgeries, which is kind of the typical way of doing a mastectomy. And that wasn't true. You know, that was what the doctors were most comfortable with.
One of the things I find most challenging is all of the misinformation or lack of information or lack of support people get along this journey. And I hear a lot of people who maybe they think that they've gone to some incredibly prestigious institution and that they're getting the very best care, but it turns out they go to a place that almost never does nipple sparing mastectomies. And no one knows that, and people don't talk about that, and you're gonna given a plan and you think that's the best plan for you. And so one of the things that's really hard to take in and hear is people feeling like they asked for something, they knew there was better, and they still kind of got that thought or that hope rejected by the team that they saw. So when I think about it, I think it's one of the reasons that community matters so much, because if you can hear others who've gone through what you think you should be getting, or maybe you hear others who've gone through something that you didn't even know existed, now you can advocate for yourself, you can ask for better, and you can find a team that will support you through that journey.
Seeing other people sharing their stories, getting personally, strength from seeing that, and then being able to also share a little bit of my own, and having people reach out saying, seeing this helped me advocate for myself. That just means everything to me, and that didn't exist when my mom was diagnosed. It breaks my heart that she didn't have those resources or that community, but I think it reminds me every day how important it is to share your story. I think getting to a place where you're finally listening to yourself, especially in a healthcare setting, it transcends beyond a healthcare setting. You just feel more confident as a person. You feel more present in who you are. I think you just like yourself a lot more. This whole process has shown me that nobody's with your body in the way that you are. So you really have to speak up for your body and for yourself.